This is Pukeology Podcast, where science meets your hilarious puke stories and the tips and tricks to stop that chuckle that you need.
You never know what's going to spew out of her mouth. Here's
my mama,
Dr. Puke Nomo.
Do your panties look like Charlotte's Web just blew her nose entirely into your underwear? Do you want to know what's coming out of your vagina and whether or not it's normal? Pregnancy Pukeology Podcast, episode 22 is perfect for you, called Vaginal Discharge. We talk about everything from color, odor, and what to do to naturally treat every vagina. Want no more morning sickness, pregnancy nausea, or how about no more headaches or migraines? Visit our sponsor, nomonausea.com, the only natural way to instantly stop your worst nausea, vomiting, and headaches now. Or just place No Mo Nausea Band on your baby registry for your delivery bag at Bye Bye Baby, or get them shipped for free on Amazon as a Prime vendor. And your little ones are always taken care of with the first No Mo Nausea Kids at your local CVS store. Looking to laugh a little bit? Pregnancy humor that may just make you want to pee your pants. Like you don't have to pee all the time anyway, with hilarious stories like Taste the Gatorade Rainbow, Cereal Made Me Do It, and Spider-Man in My Pants. If you want to learn more about your pregnancy, humor and knowledge is the key to help you survive these 9 months. And just know we're in this together. Today, you will learn the science behind why your vagina gives off different color discharge, why it smells differently, and what is it trying to tell you to keep you and your baby safe. Most importantly, 12 remedies that you can do at home to help treat any type of vaginal discharge.
The science of puke, pukeology.
Vaginal discharge has its ebbs and flows and fluctuates with hormone levels. So changes in your cervix during pregnancy also affects the amount and or the consistency of vaginal discharge. Nearing towards the end of your pregnancy, the baby's head often presses against the cervix, allowing a lot more of this discharge to come through to your underwear. But again, you're pregnant, and most of us can't even see our underwear with our big bellies, so it might not even bother you. You just may feel that squishy. Now, if you do smell something differently, because again, we have our wolf-like instincts whenever we are pregnant, please make sure that you go and visit your doctor. Any type of OBGYN or your gynecologist, they need to know about abnormal discharge because it can be a sign of infection if it has a different color, odor, or consistency, or if you have some vulvular swelling, which is just a fancy word for lips. So if it's red, itchy, any of that, we really need to make sure that you go see a doctor. But what is normal? I feel like half the time, most of my patients always ask, what is that is considered normal? Clear. The first color, clear, is a normal vaginal discharge during pregnancy, leukorrhea. So what that means is it's thin, white, milky, and mild smelling. Leukorrhea is completely normal, so there's absolutely nothing to worry about. As we move forth on the color spectrum, white, a thick white discharge. If you're ovulating, so before you actually get pregnant, the cervical mucus is actually clear, white, and a little stringy, and that comes before your period. And again, that's kind of gluey and gooey and clumpy, I think is the best way to describe it. We have a color vagina chart that we'll also place on the blog for Pregnancy Pukeology Podcast. So make sure that you check it out because you can actually see the distinction between the color and whether or not that's normal. So in early pregnancy, a white discharge is increased in amount, and that actually means that's normal. So again, a thicker white discharge, that just means that you are pregnant. In the third trimester, you will have what's called the mucus plug, and that actually loosens, and that's this very sticky, whitish appearance, almost like an egg yolk that falls immediately prior to you going into active labor. Now, White can also mean infection. A thick white discharge that has a smell or a distinct color. So a yeast infection, Candidus. Candidus is a white odorless discharge with pain during urination or during intercourse itself. That soreness, itching, burning sensation, or inflammation of the genitals means that you have an overwhelming amount of yeast that is forming. Thus, it is sloughing off in the actual vaginal tract, and it's causing this, I would say, white, almost curdle-like infection that you'll see inside of your underwear. As we move on to the color spectrum, pink. Pink can mean that there's a little bit of cervical bleeding. If you've ever had, very forceful intercourse, things of that nature, again, that pink hue is just a mixture of the vaginal normal mucus with a little bit of blood. Now, vaginal irritation, or if you're not pregnant yet and you're listening to it before you get pregnant, you actually do have a pink tinge, and that's called implantation bleeding, meaning that you are about to get pregnant. Brown. Now, brown is, again, you can have a implantation bleeding that is brown discharge. Usually brown means it's old blood, and it kind of forms this brown color because red blood means active. Brown blood means a little bit older blood, and it's mixing with that white discharge, giving it a brown-like hue. Again, all of the ones that I've discussed, with the exception of the yeast infection, you're not talking about smells. This is completely normal. So again, it doesn't have, it has a mild smell, I guess you could say. Okay, so here comes the real problems. Red. Bright red. If you are in your third trimester, if you are about to deliver and you have bright red in your underwear, you may be having what's called your bloody show. Here comes baby. It is when the passage of small amounts of blood or blood-tinged mucus through the vaginal wall enters at the end of pregnancy. This is actually caused by the detachment of the cervix, which is the mucus plug that seals the cervix usually during pregnancy, and is a sign that labor is imminent. So you're about to have a baby. Yay! Now, if you are in your early stages of pregnancy, if you're not pregnant yet, and or again, you shouldn't be having blood, this could be a sign that you have some sort of cervical infection. A cervical polyp can also happen, and then endometrial or cervical cancer. You definitely want to let your gynecologist or your OBGYN know if you are having bleeding that is not normal menstruation. And I have to mention, menstruation is normal. That happens every month. If you are pregnant and you are bleeding, that is not normal. Please make sure that you go see your doctor, especially if it's bright red discharge that is more than 1 ounce. So think of a soda bottle, divide that into 1/8. If you see blood that's about that much, please call your doctor immediately. It can be a sign of placenta previa, which means you're having blood without pain, or placental eruption. Placental eruption is blood with pain, and that means your placenta is literally ripping apart. Your placenta is also feeding the baby. It is considered a true pregnancy emergency, and you need to get to the hospital and the baby out immediately because the baby no longer has oxygen and or food and nutrients. Yellow, a yellow color. These are all bad from here on out. Sorry, guys. And if you are in your first trimester, please make sure that you do not feel nauseous as you are listening to this. So yellow is a sign of gonorrhea. Gonorrhea as a yellow discharge, and it has a lot of pain during urination and intercourse. It has a very foul smell to it. Again, gonorrhea does need to be treated by a medical professional. Please make sure that you go see your doctor. Green, trichomonas. All right, so everybody talks about the clap. That's what green is. It's nasty, greenish, yellow, frothy type discharge, itching and pain during urination and intercourse. Again, very foul type smell. Please go see your doctor as well. You will probably get a regimen of some sort of antibiotic, especially like clindamycin. Gray is bacterial vaginosis. It has a white and or yellow, like grayish, a white and grayish discharge with a fishy-like smell, without burning or an itching sensation. So What that means is you're not going to have the itching that you have when you have a yeast infection, but it will look grayish in color, and oh my gosh, it literally smells like you have a fish farm right inside of your underwear. So it is very, very, very pungent. It has that odor, fish odor, like fish tacos, and you definitely do not want to leave this untreated. Bacteria vaginosis happens naturally. It's when your bacteria literally changes its form. And again, a lot of women unfortunately suffer with chronic bacterial vaginosis, so you want to make sure that you change your habits, your bodily habits, and we're going to go into that in a little bit.
Growing up on a Tuesday? One puke story.
One day, my senior year in college, we were challenged with this so-called Gatorade set. We had 5-ish minutes to sprint 100 meters and then chug an entire Gatorade. We had to continue this inevitably until we threw up. What kind of game I was into, I have no idea. But little did I know that I was pregnant. I was already feeling exhausted. But since I didn't get my period, which was completely normal for an athlete, I didn't think anything of it. Many of us managed to chug at least 4 or 5 Gatorades before yakking. And as you can all imagine, this resulted in what can only be explained as a rainbow puke party. Vomit of every color soared in every direction. I happened to be chugging red Gatorades, which means I eventually launched nearly 1 gallon of purely red throw up in the nearest bin. The whole thing was absolute madness. The only problem is I didn't take this as my first, hey, I might be pregnant sign, since everyone was doing it. Thanks, Ivana Lechner, for your hilarious puke story. I learned from a very early age how to be a gentle, clean vomiter. No matter what the circumstances was or how badly the food needs to erupt from my mouth, I always made time to remove my shirt, lift the toilet seat, and puke in such a way as if it were not a foul smell or of undigested food interspersed with bile. It would have been downright, as described, elegant. Having said that, I did once throw up in a cereal aisle of a supermarket in Soares, Connecticut. I was pregnant with my first. I had run out of water and spent the morning eating Otter Pops to quench my thirst. So when I had arrived to the supermarket, a shell of a pregnant young woman with an Otter Pop liquid swimming in my belly, I took one look at those fruity pebbles and bam! For some reason, I felt so dehydrated and I have not had an Otter Pop since. Thanks, Andrea Fasoli, for that hilarious puke story. I was 9 months and ready to pop. I started feeling squishy in my underwear, and then I felt a plop. I ran to the bathroom and had to put my underwear almost to my ankles so that I could see what the heck it was. I saw a red booger. I had a love for cotton candy, so the second I saw the bloody show, I puked blue all over my red underwear. I started crying and my husband came into the bathroom and said, "Babe, your underwear looks like a Spider-Man comic." I giggled so hard I almost pooped, and then we realized we're about to have a baby. The contractions started a few minutes later. Thanks, Tasha Jackson, for your hilarious puke story. If you have a puke story that you just can't wait to tell us, please share it with me. Send it to me, Pukeology, Pukeology at nomonausea.com, or tweet us at Pukeology so we can all have a good laugh.
Tips and tricks to stop the chuckle that you need.
First, let me just go on the record and tell you that your vagina is a self-contained system. That being said, unless introduced by something foreign, it can usually fend for itself. If you're having reoccurring issues with bacterial vaginosis or just reoccurring issues of yeast infections and things of that nature, you need to maybe consider talking to your gynecologist or your OBGYN, but take a look at the stuff that you use every day, the things that encounter your vagina on an everyday basis, the type of underwear that you're using, whether or not it's wicking away the sweat. Also, if you're using soap or some sort of detergent that your body doesn't like, man, oh man, it's going to form a frothy substance to keep it separated from the vagina, keeping itself healthy, and the actual foreign substance that's making it do that way. Again, if you are reacting to soap, or again, are you trying to use sprays to make your vagina smell better, you're actually causing it to have more problems. So that is that warding off defense mechanism that your body usually emits. Remember, this can change your natural body's bacteria that lives inside of your vaginal tract, and it can change the vagina, the secretions in consistency, texture, and even the type of bacteria that's in your vaginal flora. I recommend that you use a great probiotic, one that is geared towards your lady parts. I personally use a 50-50 blend of 2 billion CFUs, it's just a unit of measurement, guys, of 2 different types of bacteria that are exclusively made for the vagina, Lactobacillus rhamnosus and also Lactobacilli reuteri. Did you know that in the 2012 study with women that had chronic yeast infections, 87% reported improvement in their symptoms with probiotic pills, and it actually helped them with ongoing preventative measures months later? When you are pregnant, your immune system decreases, thus causing an increase in infections all over your body, mainly in parts that you are touching the outside world, including your skin, vagina, and mouth. Before you try any of these natural remedies, please discuss them with a physician, and more importantly, please don't put anything in your vagina if your water has broken. You will have no barrier to the baby and can cause a direct source of infection for you, which is dangerous for you and the baby that's coming very soon. So how to treat a yeast infection naturally? Boric acid suppositories have been used for years, along with antifungal fluticine that have been clinically proven to treat about 70% of women. Tea tree oil has antifungal properties. Those are actually called the terpene-4-alls. It's organic chemistry, guys. Basically, it's an alcohol group that's found on a terpentine ring. That means nothing for you guys, except for the fact that tea tree is an antifungal. So when you're not pregnant, 3 to 5 drops soaked inside of coconut oil tampon, and that's inserted in the vagina, has been noted to help. Again, I wouldn't recommend placing anything in your vagina while pregnant. And please make sure that you're not allergic to tea tree. You will have burning, redness, and rash, because if you try to put it like a pure substance in the vagina, because again, your vaginal walls are very sensitive. So be careful and make sure it's nicely well diluted. Eating yogurt. Now this, I think you should do, or at least applying it to the vulva, which is, again, your lips, when they're red and swollen, and they help to contribute to a better health and restore the balance of bacteria and yeast inside of the body. This was actually shown in the 2006 research study that eating yogurt does help. If you also want to find out a little bit more about what type of vitamins and minerals you should be taking, or why you should take a prenatal vitamin in the first place, jump on over, pause this episode, and go to Pregnancy Pukeology episode 3, Why Take Prenatal Vitamins. This will give you a better reason of what exactly are important nutrients that I'm missing or maybe missing from my diet. Eating coconut oil, or even applying it externally to help ease symptoms. I personally have changed from olive oil to coconut oil in cooking. And ladies, I'm about to blow your mind. Dun dun dun. Coconut oil makes for great lube. I have lots of allergies, but I can use coconut oil just fine. And it tastes great too. Your husband will appreciate it. Don't use it with condoms, though. It will break down the material, and not like you guys are using condoms anyway with your husbands, because, ladies, you don't care because you're already pregnant. Garlic. There is actually no evidence to support that placing a garlic clove up in your hoo-ha is a remedy for yeast infection, but a burning sensation will be noted, and garlic does have an antifungal property. But again, we're talking purely clinically at this point. It has been proven that eating garlic has no effects of the level of yeast inside of the vagina. So it's kind of one of those old wives' tales. I have to talk about it. Some people may swear by it, but I'm just letting you know what the true clinical data has shown. Oil of oregano, made from wild oregano. Note, this is not the stuff that you usually find at Publix. So oil of oregano, Oreganum vulgar, which contains 2 potent antifungals, thymol and carvacol. Those 2 are wild oreganos, and they have been found to halt or inhibit the growth of Candida albicans, which is a yeast infection. So how to prevent a yeast infection and how to prevent bacterial vaginosis, because again, we talked about that gray-like fluid. Bacterial vaginosis is not something that you need to immediately go get treated with different types of an antibacteria or antifungal, but you do want to change your habits so that it helps you not get it, because it is very annoying and it smells bad too. So let's talk about all these different awesome ways that you can help yourself to not get and to prevent yeast infection, to prevent BV. Wear cotton underwear and loose-fitting clothing so your vagina can breathe. Try sleeping with no underwear while you sleep. This really will help to move forth and get fresh air in there so it's not super wet and moist. Number 2, rinse yourself off as soon as you get done with the gym. Take any wet swimsuits or sweaty clothing off immediately, and make sure that you pat down your genitals well after showering because you want it to be nice and dry. Avoid all vaginal sprays, douches, perfumes, lotions. I can't tell you how many times a vaginal allergic reaction can happen and you will literally be frothing from your vag. Use water-based lubricants during sex. Take probiotics or eat yogurt, which, by the way, yeast eats and feeds off sugar. So reduce a diet or decrease your diet with sugar consumption. This really will help. That's why a lot of women who have chronic bacterial vaginosis and or chronic yeast infections will actually go on a no sugar diet. They will completely take it out. If you've ever heard of the caveman diet, and it works. It really will, because it no longer can survive if it's not getting the food or the nutrients that these yeast need. And then once you deliver, consider progesterone contraceptives. I'm saying that because estrogen-based pills will actually promote the growth of yeast. So if you're a person that naturally suffers with a lot of yeast infections, again, after you deliver, consider a progesterone contraceptive. Now that you know what your vagina and your vaginal discharge is trying to tell you, which natural remedies actually work, and what preventative measures can be taken to make sure your vagina is in always tip-top shape. These are the answers you've been looking for to give you the best information about pregnancy that there is to date. Thank you again for listening, and if you love Pregnancy Pukeology Podcast, let us know with a 5-star rating or hearts for like. Don't forget to download this episode, but more importantly, share it with all your prego friends. Thanks again for listening to Pukeology Podcast in Pregnancy, Episode 22, Vaginal Discharge.
Pukeology Podcast, edutainment at its finest.